Hi there and welcome to my channel. In today's video we'll discuss about Dutch health insurance. We can start with a question: who is obliged to have Dutch health insurance? So everyone who wants to stay here longer and who are registered with the municipality have 4 months after their arrival to arrange Dutch health insurance. Also, parents who have kids have to insure their kids, and they have also 4 months of its birth. There are many different healthcare providers here in the Netherlands, so you can ask a question where you can compare different policies. So you can go to a website which is independer.nl to compare different healthcare providers. Can you avoid paying for a Dutch health insurance? I don't recommend it because you will get fined, so it's better to arrange it yourself and avoid unnecessary fines. Are there different types of insurance packages? Yes, there is a basic one and there are also available additional ones. But with basic ones, the government decides what should be inside basic package, and then private companies are implementing it. So if you choose a basic insurance, the difference between different companies, different healthcare providers are not big. There can be a slightly difference with costs, but not with what the package consists of. And what is own risk? In Dutch, eigen risico. This is annual costs that you are willing to pay out of your pocket before your insurance provider kicks in. And you can choose it between the lowest and the highest level, which is now 385 euros, the lowest one, and the highest one is 885 euros. And how does it work? For example, your GP can send you for some blood tests, and then you are first paying from out of your pocket, from your own risk, till this amount you choose, so the lowest or the highest one. And after you achieve this amount of high risico, your insurance provider start to pay before you are paying from your own pocket. So you are paying for your, when it comes to costs, you are paying for your basic health insurance, and also you can expect some additional costs which are related to your own risico. So you can think, let's say this way: I'm generally a healthy person, I don't think I'm going to visit specialists, I'm not going to have many health checks, so I will choose the highest self-risk, and then my monthly fixed price for the insurance will be lower. Or you can also think like that: I don't want to have more than 385 euros per year additional costs, so I prefer to pay a bit higher fixed amount for a monthly healthcare, and then in case of emergency I'm more relaxed, because I will have to pay only 385 euros, not 885. What's also important to say, you don't have any additional costs to see a GP or a midwife. It's covered from your basic health insurance. But if you will have prescribed some medicine or some blood test, or you will visit specialist, then you will pay from your own risk and out of your pocket before your insurance provider start to reimburse your costs. But if you expect that you will, that you need some extra care, you can also add some additional packages to your basic insurance. And for example, what you can choose: a dental care, some extra maternity care, because not everything is covered from a basic insurance. It's worth to know. What else? Appointments with some physiotherapists, so you can, for example, choose that you want to have 15 appointments per year just in case with physiotherapy. So choose what your healthcare provider can offer you with these additional packages, and make sure that you want to pay this amount of money for additional packages per year, and it's the best option for you. Let's say that GP prescribed you something or send you to an appointment with some specialist or for some screening. So to find out how much will it cost you, you can ask a GP or call the place where you will have an appointment and ask about the costs. Or also you can check it with your insurance provider, calling them or using a chat on your mobile application or a website. This is how you can check it, and then you will be prepared how much you will be, how much your expenses for the additional expenses will be. And what about kids up to 18? Kids are insured under their parents' policy. You don't have to pay additional costs for your kids till they are 18. So if you have a basic insurance and you want to insure your kid also will have this basic package. And if you have some additional packages in your insurance, your kid also will have these additional packages. This is how it works. And what is more about healthcare of kids, that there is a special institution which is called Center of Health and Family, Consultatiebureau in Dutch. And in this place you will find out information about vaccination of your kids. They take care about healthy kids, and they also have doctors in Consultatiebureau. What else you should know about Dutch healthcare system? So from my point of view, you should know that there are 3 different types of healthcare policies here. So even when you choose one healthcare provider, they can have different policies, and these different types of policies influence the price of your insurance. So you have in-kind policy, which is natura police, and in this kind of policy, care provider costs are fully reimbursed if there is a contract, and partially if there is no contract. They are cheaper than restitution policy. The second one is restitution policy. In this type of policy, you have free choice of care provider, and costs are fully reimbursed in conformity with market levels. And there is also a combination policy, which is combination of both in-kind and restitution policy. Everyone has the same access for the healthcare, and it doesn't rely on where are you from. Healthcare providers have to accept you for the basic insurance, But for additional insurances, they don't have to accept you, or they can ask some more informations related to your health before they accept you for the additional packages. So keep it in your mind. What is the first thing to arrange after you choose your healthcare provider? So the first thing is to choose your GP, general practitioner. In Dutch, it's huisarts. And why it's so important? Because GP is in the center of the healthcare, and I will be talking about it later. But when you will be choosing your GP, try to find GP near your home address, because in some emergency situation, GP can visit you at your home. If you struggle to find GP, you can also contact with your healthcare provider. They can help you to solve this problem. Okay, so what if you want to visit a specialist? Can you arrange it by yourself? So the answer is no, you can't. First, you have to start with making appointment with GP, and then GP will decide if you have to visit specialist or not, and if yes, he will give you a referral, and then you can make an appointment with specialist. Even if you have a problem with your mental problem, you also first visit GP, and maybe GP can help you to solve this problem. If not, then he will give you a referral. Without visiting GP, you can make an appointment with midwife, dental care, and alternative medicine, and that's it. So this is why choosing your GP and arranging it after choosing healthcare provider is first step, and why it's so important. Are there any healthcare benefits for those who have lower income? Yes, for those who have lower income, the government provides healthcare benefits. And here under this link you can check the income requirements. And under this link you can apply for healthcare benefits. And what about traveling abroad? How Dutch healthcare insurance work in emergency situation when you are abroad? So, if you are in emergency situation and you have to visit some specialist, go to the hospital, your cost of your healthcare will be covered up to the cost which you would pay in the Netherlands. The rest you have to pay out of your pocket. When you can change your insurance provider or your insurance type? So the only time slot to change your insurance is between 1st and the last day of January. You cannot do it in the middle of the year, so remember it while you will be choosing the insurance, the type of insurance, and also additional packages. Where you can buy medicine here in the Netherlands. So the medicine can be bought, of course, in pharmacy, and when it comes to prescribed one, you will only receive it in the pharmacy, but you can also get some medicine in regular shops like Albert Heijn, Lidl, Jumbo, and so on, and with some chemists shops like Kruidvat. Who is responsible for making a payment for a Dutch health insurance? So you are responsible for the payment, and you are paying for a Dutch health insurance from your net salary. It's comparing it to Poland, it's slightly different, because when you have a contract of employment in Poland, your employer is covering the cost of your health, and it's not your issue. You don't have to worry about it. But here you have to do it yourself. And what should you do in case of emergency situation? But emergency, I mean urgent but not life-threatening. First, you should contact with your GP, and if his or she's not available, then you should contact with after-hours health medical clinic, huisarts and post. And my advice is check your neighborhood and save the number for after-hour medical clinics for that kind of urgent situations. And don't go to the emergency to avoid troubles and any concerns. And what about sick leaves? And if you have any concerns related to your work or you are sick, you will contact with a specific doctor which is responsible for sick and work-related problems, and it's called arbo-arts. Thank you very much for watching this video. If you have any questions, leave them in the comment box. I will try to answer. If you like my content, if you like this video, click like and also consider subscribing. It can help me to grow this channel and to make more videos. Thank you very much, take care and see you soon. Bye bye!